Hello everybody, and you're very welcome to this broadcast about living with osteoarthritis. I'm Gráinne O'Leary, Chief Executive of Arthritis Ireland. I'm delighted to be joined today by Dr Barry Sheane, Consultant Rheumatologist. So by way of introduction, osteoarthritis is the most common form of arthritis, affecting millions of people worldwide and thousands of people here in Ireland. It can affect any joint in the body, but it commonly affects the weight-bearing joints of the knees and hips. So Barry, you're very welcome, and thank you for joining us here today.
Thanks, Gráinne, for having me.
I'm going to start off with the first question. What is osteoarthritis?
So osteoarthritis is the most common disease of the joints in the world. It is a condition that involves the whole joint. We commonly talk about osteoarthritis being about cartilage and cartilage wearing down, but we actually feel that cartilage breaking down is the end process of the whole disease, and the actual disease itself possibly starts in other structures in the joint. For example, the bone underneath the cartilage, in the joint fluid perhaps, in the lining of the joint, the synovial membrane, and perhaps the cartilage, and perhaps all of those structures.
Okay, and what are the key signs and symptoms of osteoarthritis?
So the main symptom that will alert somebody that they may have an issue with osteoarthritis is pain. It might be pain when somebody is doing an activity, towards the end of an activity, maybe just after an activity. Some people will report that they have some stiffness if they've been sitting for a long while, if they haven't been using an effective joint for a while. And it can progress to involve pain at night that keeps people awake, and even joints can change shape and become deformed.
Okay. And we can talk a little bit more about what actually happens in osteoarthritis. You mentioned that kind of term wear and tear, and it's a term we often hear people referring to their type of arthritis as.
Yes.
So can you just tell us a little bit more about what's actually going on there?
So we all use the term wear and tear. Rheumatologists, orthopedic surgeons, physiotherapists, all of us involved with treating osteoarthritis. But most of us recognise that the term is most likely inaccurate. There is certainly causes of osteoarthritis which relate to damage and wear and tear. But most of the issues and causes of osteoarthritis involve other processes. For example, the genes that you're born with are probably the biggest effector. If you're overweight, and being overweight will affect not just the weight-bearing joints like the hips and the knees, but also as a risk for hand osteoarthritis. If you're female, that's an added risk compared to being a male. If you have damaged a joint, so from a sports injury or some type of injury in the past. And getting older is also a risk factor.
Okay. And are there things that people can do, to prevent getting osteoarthritis? I mean, you mentioned there about the genetics. I guess we can't do much about
Yes.
the genes we're born with, but are there other risk factors that we can maybe reduce in order to prevent it?
So there are things that you can't avoid, like your genetics. But there are some things that you can certainly do, and one of those things is to stay as fit as possible, to exercise regularly, and to try and maintain your optimum weight. So the weight when you are approximately 21 years of age. So if you can get to that weight, or get close to it, or even lose some weight if you're carrying some more pounds than you should be, you have a significant risk of reducing your risk of osteoarthritis. So for every extra pound or kilogram you carry, you are putting an extra 4 pounds or 4 kilograms of pressure through your knee. Also, in that regard, if you lose a pound or a kilogram of weight, you're taking that pressure multiplied by 4 off the joint, which can be significantly beneficial.
Okay, and you sometimes hear people, talking about, well, sure, I'm getting older, it's inevitable that I'm going to develop osteoarthritis. Is it an inevitable part of aging?
It isn't inevitable. There is a higher chance as you get older that you will develop it. 2/3 of people who have osteoarthritis are under 65. About 15% of a general population will have osteoarthritis. So yes, the risk of it increases as you get older, but it is not inevitable. And people who are an optimum weight and who exercise regularly do have a lower chance of osteoarthritis. For example, if you can lose 5 kilograms of weight, you reduce your risk of osteoarthritis by 50%.
Wow, that's quite a staggering statistic. Yeah.
But easier said than done.
Sure. You mentioned there about sort of damage to the joint or injury. You know, what about people who've been in accidents, you know, or experienced, for example, sports injuries when they were younger? You know, are they at greater risk of developing an OA?
Unfortunately, yes. So one of the things that is important if you are going to be exercising is that you try and ensure that you have supporting structures around your joints that are as strong as possible, particularly the muscles. And if we're talking about knee or hip arthritis, you're talking about strong thigh muscles, strong buttock muscles, strong core muscles. Unfortunately, we know that significant injury will potentially lead to osteoarthritis. For example, half of people who rupture their cruciate ligament will go on to develop osteoarthritis and possibly need a knee replacement.
And in terms of, I guess, you know, people who are experiencing maybe signs and symptoms, you know, how is that actual diagnosis of osteoarthritis made? So
the diagnosis is made usually with clinical skills rather than actually needing fancy tests. So when you approach your doctor, you will have some of the characteristic symptoms, like I said earlier, pain when you're moving your joint or afterwards, maybe some stiffness in the morning when you wake up first thing or after sitting for a while, pain towards the end of the day, maybe the joint has changed shape, maybe it has been swelling. They're things that your doctor will use to help diagnose. Then when your doctor examines you, they may see some of the characteristic changes you see in osteoarthritis, such as restriction in how the joint moves, certain types of noises we call crepitus when the joint moves, maybe changes in the shape of the joint, bony swelling. X-rays can be used to help diagnose the condition, but they're not essential. MRI tends not to be used unless absolutely necessary. And blood tests, unless the treating physician feels that there could be another cause for the joint condition, such as gout or rheumatoid arthritis, are generally not needed either.
Okay. I think a lot of people sometimes feel that, you know, if it doesn't show up on an X-ray, it's not osteoarthritis.
Yeah.
But that doesn't really build the whole picture, sure doesn't
it's absolutely true. And what you often see is somebody come into your clinic and they will have an X-ray of their knees on the screen, and you will look at the X-ray and the right knee might look much worse than the left knee on the X-ray. And you'll sit and talk to the patient and you'll find that they have absolutely no symptoms in their right knee and it's all affecting the left knee. So the X-rays can help, but they're not everything.
We mentioned about the hips and the knees, you know, being, you know, the key weight-bearing joints that are often affected by osteoarthritis, but, you know, what other joints can be affected by osteoarthritis?
So one of the most commonly affected joints is the joint we call the thumb base or the CMC joint, and this is one of the most used joints in the body. So it's common for people with osteoarthritis to develop pain in this area, and this can manifest as pain also coming into the web space here or down into the thumb. Other joints that can be commonly affected include as we call it, the first MTP joint, or just the base of your big toe. Your neck or cervical spine, your low back or lumbar spine are also areas that can be affected.
So moving on, let's have a look at how osteoarthritis is actually treated.
Yeah.
Can you tell us a little bit more about that?
So there are many societies and international bodies who meet on a regular basis to discuss recommendations about how to treat osteoarthritis. And every single one of those organizations recommend exercise as the core treatment for osteoarthritis. So that is the first thing to say. Also, and we've mentioned it earlier, is optimizing your weight. That doesn't mean you have to lose 10 kilos, 10 stone. It means that you might just have to lose some weight to try and take some pressure off your joints. So they're the two core things: good diet, maintaining your weight, and exercise. Then you have other measures such as pain-killing treatments. We prefer those types of medications that don't or limit side effects. For example, the anti-inflammatory gels. And there are many studies that would say the anti-inflammatory gels are nearly or just as good as the anti-inflammatory tablets. So we're familiar with medicines like ibuprofen and Nurofen, which are simple anti-inflammatory medicines. They are actually very effective treatments for osteoarthritis. However, we try and use them as little as possible, because if you are taking those medicines on a regular basis, we worry that there may be issues with the stomach ulceration. We worry about the cardiovascular system, and they can potentially affect the kidneys and your liver function as well. But nonetheless, many patients with osteoarthritis will need anti-inflammatory tablets, and they can work very well. Paracetamol or Panadol is also a medication that you will hear used. That has lost a lot of favour in the last number of years as an effective tool. It's felt not to have a very good pain-killing effect. If we compare the pain-killing effect of exercise to the anti-inflammatories, the studies will say that they have a very similar pain-killing effect. In fact, exercise might outperform the anti-inflammatories, and that is a scientifically proven fact, and it's interesting. Then you will also hear of people having had steroid injections into their joints. Steroid injections can work well, but they wouldn't be a tool that you would use first off. You would try exercise, supervised physiotherapy, and then some of the other measures. Increasingly, many of us are using something called hyaluronate or hyaluronic acid. Hyaluronate is a natural component of your cartilage and your joint fluid, and in a synthetic form, when injected into the knee joint, it can have an anti-inflammatory effect and help with pain as well. Then there are other measures, for example, unloader braces, which are contraptions that you will wear over your knee if you have, as we call it, malalignment, or the alignment of your knee isn't perfectly straight. They can help certain types of osteoarthritis of the knee. And then at the end of the line, if those measures are failing and somebody's in pain and they can't carry out their activities of everyday living, you have to visit the surgeon and discuss maybe a joint replacement.
Okay. And in terms of the patient themselves, what can they do themselves to help manage their osteoarthritis and to manage their pain?
So in terms of helping themselves, exercise, once again, and I'm sounding like a broken record, but that is the key treatment. Now, the problem with exercise is that if you've never exercised before, it feels like a huge barrier, a huge mountain to climb. Exercise doesn't mean preparing for the Olympics or preparing for the Tour de France. It might mean getting off the couch and walking 500 meters and going home, and trying to do that, even 100 meters, and trying to do that every second day for a month, and then slowly but surely trying to increase that. Overwhelmingly, the evidence would say that if you're going to start an exercise program, you should engage with a physiotherapist or a physical therapist to help guide you, and the encouragement you get from somebody else also tends to lead to better outcomes, because you're more likely to, I suppose, do what you're told, and if you have someone supporting you, you may have a better outcome. Then in terms of other measures, for example, say if you take up an exercise program, you may find that after exercise the joint plays up a bit, that you have more pain in your knee or your hip or your shoulder or whatever joint is affected. There are things you can do to limit that pain. For example, you can ice a joint that's affected. Now, it sounds very archaic, but taking a frozen packet of peas, wrapping it in a J-cloth and just placing it over the affected joint for a minute and leaving it off for a minute and repeating that for 5 minutes can help. Some patients will take painkillers preemptively. So, for example, somebody is going to go for a 30-minute walk. They know at the at the end of the walk they'll be in pain, they may take an anti-inflammatory or rub on their anti-inflammatory gel before they go on their walk. So there are different things you can try. One of the things to look out for is developing pain after your exercise when the pain is prolonged. If your pain is prolonged after you start exercising, you're doing too much and you have to go back and maybe just reduce the duration and the intensity of your exercise and try and build it up slowly. But that again is where a physiotherapist or a physical therapist can be very useful.
And just for people watching as well, we actually have accompanying videos on exercise and also on diet and healthy eating as well. So just a word to people who are watching this.
Great.
So just, some discussion around osteoarthritis and other conditions. So many people who are, diagnosed with osteoarthritis might be living with other conditions as well, such as diabetes, maybe obesity or osteoporosis, cardiovascular disease you mentioned as well. Yeah. What can people do to manage in these more complex situations as well? Yeah,
so that's a really good question. I'm not going to mention exercise as the first answer because it'll get monotonous. The anti-inflammatories are, as I said, a very useful medication for osteoarthritis. But, as I also mentioned, there can be issues with side effects. So if you are diabetic and you have associated kidney disease or you're at risk of heart disease, then the anti-inflammatories will generally be discouraged. So the anti-inflammatory gels or paracetamol may be more useful. The same way for kidney disease, the same way for patients who have heart disease or stroke. But getting back to exercise, again, if you have heart disease, if you suffer from obesity, if you have diabetes, exercise is a key treatment that patients who suffer from those conditions should be engaging with.
Okay. Moving on now to some of the myths around the causes of osteoarthritis. I'd like to discuss a few of those. So one we get asked a lot about in Arthritis Ireland is, what about the weather?
Yes.
So, does it cause osteoarthritis? Does it make it worse?
Sure.
I'm sure this is something you're very familiar with being asked about.
Yes. Well, believe it or not, I have a bit of osteoarthritis in my hip. And so I know when it is a tiny bit colder or damper, I'll get a tiny bit of discomfort in it. So cold weather, damp weather doesn't cause osteoarthritis, but it can sometimes make the symptoms somewhat worse. But osteoarthritis is prevalent throughout the world, at the equator, in warmer climates, in colder climates. So it doesn't have a role, but it can sometimes make the joints feel more sore.
What about diet? Yeah.
So diet is something that I am always asked about, and patients are very interested in their diet, which is always really encouraging. Often people go to extensive lengths to eliminate foods that they think or they read or they hear about are causing their arthritis. For some reason, tomatoes have a bad reputation, citrus fruits. They will not in any way affect your osteoarthritis. They will have much more beneficial health effects rather than a detrimental effect on your joints. A healthy, balanced diet is what everybody needs. You'll read about an anti-inflammatory diet. Essentially, an anti-inflammatory diet are plenty of food, plenty of fresh foods, vegetables, fruit, some oily fish, limiting your exposure to processed meats and processed foods, drinking plenty of water, not cutting out bread. You don't have to go gluten-free if you have osteoarthritis. Trying to limit how much alcohol you drink, not smoking, and trying to maintain your weight. Those measures essentially constitute a healthy diet. Also, making sure you get enough protein in your diet is important because one of the main structures that helps support your joints are your muscles. And if you're not getting enough protein, you may not be able to replace the musculature adequately. So your diet is essential, but that does not mean you need to eliminate things from your diet. People who are drinking pints of apple cider vinegar every day should probably stop doing that. Okay. Because it's not very nice either.
No, it's not. And one of the other myths, and we've talked a good bit about exercise, but what do you say to people watching who, may have grown up with that belief that exercise is bad for their arthritis?
Yeah, and that's nobody's fault. If it's anybody's fault, it's probably the medical profession, because many of us over the years have said you need to stop exercising now, or propagated the myth that running is bad for your joints. There is some very nice research that has shown that people who are sedentary get much more severe and prevalent osteoarthritis of their knees than runners. So exercise is not bad for your joints. If you have pain in your joints because of osteoarthritis, the damage essentially is done. And what exercise does is, well, it has a number of ways of helping the joint. First of all, if you don't exercise, your joint fluid starts to deteriorate in quality. So when you start exercising, you help to maintain and replenish healthier joint fluid. Your joint fluid is important because it acts like a shock absorber. And if your joint fluid isn't healthy, it might contribute to your cartilage breaking down quicker. Also, exercise helps to maintain strong muscles which support your joints. So there are so many reasons why exercise is the most important treatment for osteoarthritis. But we have to challenge what many people's impression of exercise is. And I think the videos you mentioned will be very helpful in that regard. Once again, it does not mean that you're going to become a professional athlete or you're going to spend hours in the gym trying to exercise. Far from it. Just getting up and moving might be the first step.
And just moving on now to issues around surgery and joint replacement, at what point do those sort of interventions become the best option for people? And is there a percentage of people that do go on to need surgery that are living with osteoarthritis?
Yeah. So the only cure we have for knee and hip osteoarthritis is surgery. That is essentially a cure, but it is an extreme cure. And if you can avoid surgery, then you should. However, the outcomes from knee and hip surgery are absolutely excellent. But ultimately what we want to do is try and avoid surgery if we can. The risk of hip and knee osteoarthritis is approximately 25% and 45% respectively throughout your life. So in other words, you have a 1 in 4 chance in your lifetime of developing hip osteoarthritis, but you have a much, much smaller percentage chance of needing a hip replacement or a knee replacement. I can't give you a precise percentage, but it is considerably lower. So if you have hip or knee osteoarthritis, you are much less likely to need surgery than anything.
Okay. And lastly, what does the future hold for osteoarthritis? We sometimes hear people speaking that, there's not a lot happening in this area. When you compare it with maybe other types of arthritis, people see great advancements. Yeah. Is there research going on in this area? Is the future looking any bit brighter for people living with osteoarthritis? Yeah.
So I think we're on the cusp of major improvements in definitive treatments for osteoarthritis. And there is a lot of research going on worldwide. Remember that osteoarthritis is costing the global economy billions every year because of lost days in work, because of expensive surgery like knee and hip replacements. So there's a real incentive for us to get definitive treatments and cures for osteoarthritis. So there are a number of treatments that for the first time results have started to be published in the medical journals. And some of these treatments are looking at repairing cartilage, so allowing cartilage to regrow. Some of them are looking at stopping cartilage breaking down. Some of them are actually looking at ways to prevent pain. And one of those particular medicines block a protein called nerve growth factor. And those medications may well be becoming available soon on the market, but they will be for people with severe osteoarthritis. So there are many positive things that are emerging, and I think over the next 5 to 10 years we're going to see an explosion, hopefully, in new therapies.
Well, I think that's a really positive note to end our interview today. Thank you very much, Barry, for joining us and for sharing your expertise.
You're very welcome, Gráinne. Thank you.
And thank you very much for watching this video. You'll find lots of information about osteoarthritis on our website, arthritisireland.ie, and we also have dedicated support groups on Facebook. You can contact our helpline also on 0818 252 846. Thank you for joining us.